Well, it's the most common type of cancer in the U.S. We're talking about skin cancer, and this month is Skin Cancer Awareness Month. First News contributor Dr. Michael Sevilla is here to talk about some common skin cancer questions. Dr. Sevilla, what do your patients ask you? Do they get more nervous when they see skin changes and so on? Do people pay attention, or do you notice much of a difference today?
I think people are learning about it more now. There's about 3.5 million new cases every year. So anytime there's any kind of skin change, whether it's a mold or whether it's something growing, whether it's something just not healing or itching, they really let me know about it.
Okay, so the real idea is if you see something change, because a lot of us know you have little moles, or we used to call them beauty marks when I was little, the little dark spots on your skin. How do you know when things are changing? What do you look for?
You look for anything changing at all, whether it could be the color, whether it could be the size. Sometimes it could be a little bit more difficult in darker skinned people to see if there's changes, but there's any kind of changes at all, definitely should get checked out by your doctor.
Okay, so everybody says sunscreen, sunscreen. Like on a day like today, we just saw that outside picture and it looks foggy, cloudy. Do you have to be worried about sunscreen all the time?
Not so much, you know, on a day like today where it's a little bit more foggy, but always you should be worried about ultraviolet rays. Because it can come through even on a cloudy day.
Okay, so what type of SPF should you use?
Well, everybody says SPF 30 is kind of the lowest point where to start with. To put it on maybe about half an hour before you get into the sun.
That's important.
That is important. That is important. And the sunlight is most intense between 10 a.m. and 4 p.m. So that's when people really should be aware of the sunlight.
Okay, now I'm going to ask you the vitamin D question. You know, everybody knows you need the vitamin D. In order to absorb the vitamin D in your body, you need some sunlight. And a lot of people in our area, especially because we don't get quite as much sun, are deficient in vitamin D. So what do? It's sort of like a balancing act. Do you need to go without sunscreen so that your vitamin D comes into play?
That's a good question. I get that a lot. Where is the balance between how much sunlight you get from vitamin D and your risk for skin cancer? What I tell everybody is that definitely always wear sunscreen. You will get enough vitamin D from the sunlight, not enough to risk your skin for skin cancer. And then for vitamin D, you can always take supplements to supplement that vitamin D level.
So you don't have to worry so much. Because there's been articles out there that tell parents our kids aren't getting enough vitamin D, and you know, they need to play outside and get more sun. They still need to be protected.
Yeah, especially in this part of the country where we don't get a lot of sunlight. I get that question a lot, but sunscreen is very, very important.
All right, thanks so much for being here this morning. You cleared up a lot of our questions. Sunscreen, sunscreen, sunscreen.
Thank you.
All right.